Hi guys, welcome back to Rts Share Tea, where respiratory therapists live out loud. With me, your host, Linda Fry, the Asthma Lady. Yes, welcome everybody. Welcome to anybody new. So today's episode, we're going to be talking about community engagement in relations to health education and promotion. So this past week, I have been working a lot in different communities in New York City. Well, actually, it's been mainly Harlem and Manhattan area. And I've been working with the Allergy and Asthma Network, being their trusted messenger and doing community outreach, providing these type of resources around asthma and allergies. So it has been amazing. I'm having a great time, and you'll be seeing some footage going about how those events have gone. Okay, so today's episode is in relation to that, and just to give you a little context behind how I got into public health. Back in 2011, I went to get my master's in public health because I wanted to know why some communities were sicker than others and what to do about that. And so I went into that journey and learning about public health and community health and how to engage the community around, and dealing with health disparities. So this is the area in my career that I am in. So I'm just having a great time. And so I'm just sharing the tips today on how to engage the community when it comes to those type of things. And so I have a few tips based on my history of doing this type of work. I've started doing asthma education in 2010. And so I've been doing different community health fairs, booths, exhibiting, being a vendor in different events. And so once again, these are some tips that have helped me. So that's what I'm going to share in today's episode. So what has helped me to engage attendees at these events? So I wrote them down so I didn't forget the really good ones that helped me. And if you have any others, let me know, chime in. Okay, so be electric. Yes. So I smile. I always look excited to be there. And usually I am. I genuinely enjoy being in the community and doing this type of work. But you can see it. You can feel it. And so I make sure I have something to eat in the morning, whatever my call time, my setup time is. I make sure I eat a good breakfast or a lunch. I make sure I have I'm not a coffee drinker, but I am a tea drinker. So I make sure I'm in good spirits when I do these type of events, because you want to be as electric as possible. You want to be excited. If you're not excited about what you're doing and what you have to offer, no one else is going to be. All right. So that really helps to draw people in to what you have to offer. And so when I speak from a place of I am saving your life with this information, because I don't know if I'm ever going to see you again. And I don't know who that information is going to help. So I speak from that tone, like this is important and I have to give it to you today. Okay, so receive it. So yes, be electric. That's number one. Number two, get from behind the table or behind the booth. Come to the forefront. So what I like is kind of like the tag team approach, or if you have a team of people, if you're out in the community, so you have the one person that might be behind, sitting at the table, at the chair, at the table, collecting information or handing out stuff. But you do need somebody to be in front of the table to engage and get people to buy in, to come to see what you have to offer. So don't be scared to, be in front and get folks' attention and draw them into the information that you have at the table that day. Okay. So next I have listen listen to people as they speak to you. Listen to their concerns, because once they start to see what you have to offer, that aha moment might kick in to like, oh yeah, I need this, or I know somebody that needs this. And listen to them when they say, oh yeah, my mom has really bad asthma, or oh yeah, my nephew has bad allergies, and we remember when he had to go to the emergency room. So stuff like, so listen to those type of stories, and be empathetic, and just kind of go from there and see what can help them, what resources that you have at your table that can help them at that current time, and lead them to more information where they can go to for quality to access to quality information. So you want to make sure they're going to the right place, evidence-based places, and not just going to some random person on different, social media platforms. Yes. So listen, let people know up front what you have to offer that day. Right? So it's almost like any type of store. When the store says sale, the store will say 50% off, or it'll just say sale. Once you get into the store, they can sell you whatever they want. You understand what I'm saying? So the sale, it might be just what's on the front, but you do need something to attract people to your table. All right. So let them know up front, to your table, your booth, or whatever. Let them know up front, what do you have to offer for them that day, so they can come and stop by. And and it shouldn't be anything too complicated. For us, it was you got a e-gift card, a $10 e-gift card for online shopping. If you were interested in filling out the asthma screening survey. So that was, we let you know right on front, for exchange for your time in filling out this survey, we will provide you with this gift. So let them know up front what they get. This is just a good way to engage the community once again, to get them to buy in. Okay. And let me see, what else did I have? Oh, now this might be, I guess for some people and a no for others, but it does help for me. I like to have colorful materials on the table, especially when you have forms to help people out on your booth or on your table. Because if your forms, like let's say the medication administration form, right? So the MAF form, for those for kids that have asthma, they need these for school enrollment. It's a white form with black words. So if you have a bunch of forms like that, and I've had events where I had to have a few of those forms, like a back to school event, have colorful things around it, because you want things that attract people's eyes. So I do like colorful handouts, colorful flyers. Some people really like, that clean look. They don't want their table or their booth to look too, I guess, like too much is happening. But for me, I do like a lot of pops of color on the table, to kind of get somebody to be like, what's this, or what is this about? And then you can go in and describe what you have going on that day, or what you have to give to them. So yes, and the last but not least is have a way to collect their information. Right? So you're not going to have everything that day. So collect information so that you can reach out and say, hey, listen, when we have these other programs, may we contact you, get the permission up front right then and there. And have a way to collect the information, a sign-in sheet or whatever. And especially if you're grant funded, if you have funders, sponsors, they also like to see this. So they like to see where the materials that you've invested in or whatever, where they're being distributed. So have some kind of sign-in sheet or collect the information so you can show where the materials are being distributed. So that's always something good to have. And it lets them know, well, how many people did you engage that day? You'd be surprised how many people just come by your table and just grab things. Sometimes because you're speaking to somebody else, and you might miss that person that just kind of grabbed a pamphlet or two to give to their family members or whatnot. And those, that's important. So you can kind of have something to track that down, or let the person know, hey, listen, you're able to have access to anything on the table. Just, we just want, we just want a little information to let us know where the information is being distributed. So that is something great to have at the table. And I believe that's about it, pretty much. That's what's been helping me with community engagement. That's how I've been doing it for a few years now. If anybody else is doing this type of work, let me know if other things have been working for you that I have not mentioned. These are just things that I wrote right off top of my head that I've been doing, and it works. So all right, guys, so I hope you learned something from me today. Remember that we are growing together. So many other things coming up in the pipelines. I have so much more content coming up, more guest speakers. I have events lined up. I will be at the conference at the sea, with the Maryland and DC Respiratory Care Society. I will be with them in September 15. I will have that information in the description. I'm traveling quite a few. I'm traveling a lot, so I'm trying to remember off the top of my head where I'm supposed to be. It's a good problem. Also, for anybody that's really interested in this type of work, know that we have the book, Asthma Control Please, 9 Steps to Community Engagement and Asthma Awareness. Like I said, I've been doing this for a little bit, and I have, for those that have questions about how to do it or about having, building an asthma program, I have some good tips in this book. It's still, I want to say it's still free as an ebook on Amazon Kindle Unlimited. So yes, I will have the description for that also in the link in the video. And so, all right, guys, well, thank you so much for being here. Remember to invest in yourself and to only compete with yesterday's version of you. I'll see you next week. Bye.